Alrighty, we are going to go ahead and get started. People are going to still be trickling in, but we wanted to just thank you guys for taking time out of your day to attend this webinar with us. Just please note that we are recording and this will be sent out afterwards via email. Please send any questions you have through the Q&A option, and then we'll make sure Adam addresses those throughout the webinar. And I'll hand it over to you, Adam.
Awesome. Hello, everybody. Good to be here with you today and talk a little bit about a funding option that might be familiar to you might not. I guess just to give you some background on this funding source, Avkin really identified this funding source in 2023 as we were getting some information to people ordering from this source. And so then we started proactively kind of looking at it a little bit further. And it's been a great funding source for healthcare simulation overall since we've been tracking it in 2023. And I'm really excited to kind of share with you all today a little bit of the details on it, what it looks like, why it's different from grants and private philanthropy, and kind of how you can tackle it and go about it. So good to see some familiar faces in the room. Hi to Deb. Gianluca from Italy's in the room. Kevin from Salisbury. Hello, Kevin. Sarah. Great to see some familiar faces with Avkin here. And thanks again for joining today. Again, I'm going to kind of start here and walk through kind of maybe the history of congressional appropriations, give you a baseline. We'll talk a little bit about what it means in today's age. We'll get into kind of a heat map of where this funding is supported across the country. And then we'll talk about how you go about it and what do you do exactly to apply for it. So without further ado, we'll move on to the first slide here. If you do have any questions, I'm happy to answer them in the middle of this webinar. We won't need to wait till the end. It's probably a little bit more pertinent to the slide that we're on if we do have a question. So if you have a question, throw it in the Q&A. I'll do my best to answer it. I've studied this funding source for 2 years, and so I hope I can answer all your questions about it. So what is the legal basis for congressional appropriations? It's based in the U.S. Constitution. If you review Article 1, Section 9, and Clause 7, it says no money shall be drawn from the Treasury, but in consequence of appropriations made by law. And a regular statement and account of receipts and expenditures of all public money shall be published from time to time. The real way that I've studied this is the publishing of the records. So we are able to go through and review those records, review what institutions or organizations have been supported with this funding. And most of the senators have a fairly thorough couple sentence description on what the funding is purpose built for. And that allows us to draw some conclusions on how it's funded healthcare simulation and how it's supported healthcare simulation specifically, amongst a myriad of other things. So what is the Appropriations Committee? The Appropriations Committee is primarily driven by the House of Representatives, but then ultimately the bill is also approved by the Senate. The committee tends to be less partisan and more bipartisan. Bills often get significant bipartisan support, both in the committee and on the House floor. The House floor referencing the House of Representatives and where bills are ultimately negotiated and passed through. Committee members have a compelling interest in ensuring the legislation will contain money for their own districts, and that's part of the reason that it ends up most of the time being a bipartisan support. The Appropriations Committee is something you should be familiar with, as there are leaders within the Appropriations Committee, or I guess people that are assigned within the House of Representatives and the Senate to the Appropriations Committee in both areas. Where does this relevant for higher education and healthcare simulation, and also hospital and health systems? The most relevant subcommittee out of the 12 to what we do in simulation is the Labor, Health, and Human Services, Education, and Related Agencies Subcommittee. As I mentioned, there are 12 subcommittees overall, but this one is where we've seen all the support and funding for higher education and hospitals and health systems specifically, and specifically as it relates to simulation, but again, amongst a myriad of other things. What is the Labor, Health, and Human Services, Education, and Related Agencies Subcommittee? Currently within this, the applications for this subcommittee are only supported by the Senate. In reviewing this historically, it does look like the House of Representatives did apply for appropriations with this subcommittee, but at some point, and without my direct knowledge of why, it currently is only supported in the Senate. So if you're applying for this subcommittee for appropriations in the subcommittee, you are going to your senators, not to your House of Representatives. If that changes at any point, we'd be happy to let you know and inform you, and we'll keep an eye on things. But at this point, it's primarily the senators that apply for appropriations within this specific subcommittee. This is not a subcommittee or appropriations bill that has been contentious, and usually the bill for this subcommittee is one of the first bills to be signed. There are a couple other subcommittees, if we were to go back here, there's a couple other subcommittees that are a little bit more contentious and get debated a lot more hot and heavy. And so we haven't seen that with the Labor, Health and Human Services, Education and Related Agencies subcommittee. It's usually one of the first appropriations bills to be passed and signed through. Part of the reason we believe that, in the current structure of the delegates, both of the executive branch and the Senate and the House of Representatives, that we feel that there's going to be continued support for this subcommittee and the appropriation in it as we get into 2025. So what are some statistics? How many pages? I assessed kind of how many pages there are within the entire bill for the Labor, Health and Human Services, Education and Related Agencies Subcommittee. In 2022, we had 150, 2023, 216, 2024, 103, and 88 in 2025. On each page, approximately, there were 10 funding allocations. So you can multiply these numbers by 10 and get a list or get an idea of approximately how many projects overall were supported within this specific subcommittee. So, multiplying 88 times 10, I think that's 880, but it might actually be all. So, yeah, I am 8,800. And again, if you're looking at 216 times 10, approximately 10 funding projects per page, about 21,600 funding projects that were supported across these subcommittees in various years. To be quite transparent, we have not been assessing this from a simulation perspective for an incredibly long, so this is going to be a small sample size, but and I did a little bit different of an assessment for 2025. In 2024, we assessed all of those pages, but the descriptions of what the funding is used for is a little bit more generic in that. For this year, I went into each senator's page and clicked into their appropriations on the senator's website, and usually the detailed descriptions of what that project was for was a little bit more specific when you got there. So the numbers might have been higher for 2024. We did see 4 projects that specifically used the word simulation in their description. My assumption would be that was a little higher. There was probably a couple missed when we were still kind of getting familiar with how to research this funding source. But I think ultimately the really important fact is in 2025, there were 36 projects specifically that used the word simulation in the description. And not every senator has a thorough description. So there are senators that on their website where it just says for facilities and equipment, and that's it. And so it might be used for simulation. It might not be. It's kind of a little bit harder to infer when the description is a little bit more vague or generalized. Now there's multiple senators and projects that have a really good 1 to 2 sentence description. And we'll get to a couple examples of that as we kind of move forward in this presentation. But I was just really encouraged at the amount of simulation projects that were funded this year and what that could mean for all of us here today. So where is this funding the most applicable? In full transparency, not every senator supports an appropriations bill or applying for it in general. So I did want to make sure that I kind of heat map this for you all. The green is areas that at least one senator that is still in office has supported appropriations within this specific subcommittee in the past. So green pretty much means green light here. Maybe you have to identify which of those senators it is because it's not guaranteed that both of them supported it. But the green is that at least one senator in your state has supported this historically. The yellow is that one senator in that state has not supported the appropriations application historically. and the other senator is a new and incoming senator, and we're unsure of the support levels that that person or that senator will have moving forward. The red is states that unfortunately both senators do not apply for appropriations within the subcommittee. Now, I have seen some small instances where these states and the senators that have seats in them have supported appropriations for other subcommittees. So I wouldn't completely detract you from reaching out to the staffers or the senators in your area and asking about this subcommittee specifically, Labor, Health, and Human Services, Education, and related agencies. But overall, we would advise that it's not likely that you'll get support, but it doesn't hurt to reach out, as again, there might be an opportunity, especially because nursing and healthcare simulation is bipartisan, has bipartisan support for the most part. So why should you consider this funding? Well, again, like I just said, nursing and healthcare simulation is bipartisan. And as you can see, based on the heat map here, that it is not a partisan heat map, right? There are lots of support across the board for appropriations and what that can do to support nursing, healthcare, and healthcare simulation programs. This is about 1/10 to 1/100th the size and time commitment of a grant application. Oftentimes what we see from grant applications, and you all are probably even more familiar with grant applications than I am, but they are presented from an agency like HRSA, and they are for a specific end in mind. And then you have to kind of cater your application to make sure that you're servicing the grant's objectives and goals. In this funding source, you curate what the project is and the description. You write a paragraph to your senator on what you want to fund, and it's very much more open-ended. Now, various senators have different, Google Forms or different application lengths. None of them are incredibly long from what I've seen, but they are, they vary depending on the senator, the staffers, and how the application is specifically given to the senator's office. But at the end of the day, it's open-ended. It's on you to curate what that project description is and kind of how it's conveyed to the senator's office. There's a myriad of support across the board within appropriations, and you'll see that in the examples that I'm going to show on the next slide. This supports construction, this supports renovation, and it supports equipment. So dream big. As you'll see on the next slide, we've seen funding up to $15 million for construction and renovation projects. We've seen funding up to $1 million for equipment and hire. We've seen something around 100 and 200,000 if you're really supported really well and you just need a couple, simulation equipment items here and there. So the ultimate goal, though, is dream big and really think what will make it the biggest impact for your learners, because this is an uncapped opportunity and it's all about what will really get you to the point of servicing your learners in the best regard. So let's get into some examples. Again, these are just 5 of the 36 projects that were funded, and that funding will be dispersed here in 2025. I left the institution off because I didn't necessarily think it was specifically relevant, but I just wanted to kind of, my goal here was to show you the range of different funding applications that were submitted and the range of what was awarded, right? Everything from 180,000 up to 15 million. And these are all have simulation in the description. So, just to start off at the top here, 180,000 for funding that would be used to purchase modern nursing simulation equipment and support lab technicians and faculty. 519,000 to improve obstetric simulation program and train nursing students in maternal health care. 776,000 to fund equipment for the startup of an Associate of Science in Nursing program and a Bachelor of Science in Nursing completing program, including an assessment lab, simulation lab, skills lab, and computer lab. 1.186 million funding for a nursing and allied health workforce simulation lab space to train aspiring healthcare workers. And finally, 15 million, develop a state-of-the-art medical simulation center to enhance clinical care and improve rural medicine. So as you can see here, this is why we say to dream big, really get what you need, and really think about kind of, the total amount you would need to really support your learners in your simulation environment. So what are the details? Where are we at right now? This is about a 3-month open application window. It starts, from what I found, when Congress opens in early January for the new congressional session for the year, right? That's when things kind of start. Now, the applications, not all of the applications are listed on the senator's website yet, but things start rumbling. You know, you could probably reach out to the staffers in early January, see where things are at for appropriations for the year, start to get a feel of things. Things really start when Congress kicks off in January at the start of the year. There is a myriad of due dates for each senator's application. So March and April are commonly what we've seen, but it could be early March, it could be early April, it could be end of March. Each senator has their own due date for their application, because then what are they doing? They're taking that application, they're assessing it, and they're ultimately passing it on, and they need some time to review the application. So you can touch base with your solutions consultant to kind of have them help you find the senator's application. It's not guaranteed that it's been released just yet, but we'll work alongside you to make sure that we're ready when it is. But encourage you to kind of start assessing this right now. Again, March and April, it feels like it's a couple months away, but all of a sudden it'll be right around the corner, especially given that we're all launching into semesters and student learner engagements and, you know, everything going on that keeps us busy. This is about an 18 to 24-month approval process and disbursement. So it does take quite a bit of time to get that disbursement and get that approval. Basically, as you're applying in March and April, this will go through, again, that appropriations subcommittee. It'll get negotiated. It'll get, you know, it'll have to go into a appropriations bill. That bill will have to get approved. We should know by the end of the year if your institution has been awarded and if it's been approved within the bill, and then 2026 would be the commencement of disbursement, but that disbursement doesn't happen right away. And so it is about what we've seen on average, it is about an 18-month to 24-month process. You are currently applying for fiscal year 2026 funding. So right now, everything that was approved last year is going to be dispersed in 2025 for fiscal year 2025. But that process happens in 2024. So in 2025, you'll be applying for fiscal year 2026 appropriations. Again, I think I've touched on this a little bit, but this is specific to each senator. And so it depends on ultimately what your senator is willing to support, whether they support appropriations overall, two, whether they support appropriations within the Labor, Health, Human Services, and Education-related agencies subcommittee. And then three, are they willing to support your project, right? And so it comes down to building that network and building that relationship with the senator's office. We would encourage you to know their staffers. We would encourage you to reach out to their staffers. We would encourage you to share a little bit about how your simulation center is making an impact in the community and the state. Overall, these projects are to support the citizens of the state and to support the communities that you serve. And so sharing kind of with the staffers, sharing with the senator's office, the work that you're doing in the community and the impact that you're making is really important, right? You know, build that social networking, connect with your senator's office and build that relationship with their staffers and share what you're doing, right? Ultimately, most of the projects that I see in a sales capacity, you know, we talk to projects all over the country, and there's varying levels of funding support. The most successful funding support that I see is when you share what you're doing with people, right? Whether that's your community, whether that's your state, but share what you're doing, market yourself, share how your center is making an impact. And you're more likely to get funding, not just from Congressional Appropriations, but across the board when you're sharing your story. I encourage you to start now. As I said, the clock's ticking on this for a March or April application. Reach out to your solutions consultant if you're familiar and have correspondence with them actively. If you're not in touch with the solutions consultant from Avcon in your area, you can complete the form or chat box on avcon.com. You know, we have somebody actively monitoring our chat box, or you can complete the form. We will help you learn which senators support this funding source. We have a whole, as you saw that heat map, we have a whole list of this senator has been supportive, specifically in the subcommittee, and we can go through and walk you through the projects specifically that senator has supported in the past. So it'll give you a really good idea of which senator is supportive and what projects they've been supportive of in the past, and help you kind of get a lay of the land for your state specifically. And then ultimately, build a proposal with your solutions consultant. So Again, this doesn't have to be Avcon specific. This can support healthcare simulation overall. But if you're interested in what we're doing with standardized patients, if you're interested in bringing on standardized patients at your institution, if you're interested in looking at wearable simulators and what that means for role play in the skills lab environment or standardized patient simulation in your simulation suites, reach out. We can kind of help you assess your skills lab competency checklist. We can do a thorough assessment of that and what it means in your skills lab environment. We can assess your core nursing curriculum and your simulation curriculum that's mapped to that and where standardized patients would be a fit. And then ultimately we'll provide you with a proposal that you could take that figure and go ahead and plug it in to this application. And if you wanted to add, to that, right, you'll have a proposal from us that'll give you a dollar amount from us or a couple different dollar amounts if you wish. And then you could add any other simulation equipment to that to get your total figure of what your full application is. My contact information is listed here. You can also, instead of typing out my full last name, you could also reach me at adam@avcon.com. If I can help get you to the right person, I certainly will within our team. The phone number for our office is 302-562-2110. Again, if you need any support, need to speak with somebody here to kind of assess what your options are with this, we'd be happy to kind of walk you through it. Most solutions consultants have a document that gives them all the information on each senator and all the funding projects that senator is supported. So we'd be happy to make sure you are knowledgeable on that information and have everything you need. With that, want to open it up to questions. That's all we have for you today. But happy to answer any questions about what we've seen with this funding source, what we've seen overall with the application process. Anything you have, I'll kind of pause there, give you a couple minutes to think, and we will keep it open for any questions.